Today, we have 68 new cases who have been diagnosed with COVID-19, including 4 which are epidemiologically linked, bringing our total in British Columbia to 5,372 people who've been diagnosed with COVID-19. That includes 1,737 people in Vancouver Coastal Health, 2,818 in the Fraser Health Region, 173 people on Vancouver Island Health Region, 429 people in Interior Health, 137 people in the Northern Health Region, and 78 people who reside outside of Canada. We have 906 active cases around BC right now, of whom 22 are in hospital, 7 of whom are in critical care or ICU. We unfortunately have 1 new death to report today, a person in long-term care, and that brings our total of people who've died from COVID-19 to 204. And our condolences go out to his family, their community, and their care team who looked after them. We have 2,810 people now who are under active daily follow-up with public health because they have been in close contact with somebody with COVID-19, and we have 4,253 people who have recovered. We have no new healthcare facility outbreaks. We have 11 active outbreaks right now in our healthcare system, 9 in long-term care or assisted living, and 2 in acute care units. Our number of cases in our long-term care, assisted living, or acute care are 714, including 432 residents and 282 staff. We have 1 new community outbreak to report. This is an outbreak in the Interior Health at a construction site for a water treatment facility near Elkford, BC. And BC CDC and the Interior Health are investigating and monitoring this outbreak. There have been 7 cases. The outbreak was identified after workers had returned to their homes. 6 of the 7 cases reside in Alberta and 1 in another health authority in British Columbia. So the coordination function across the country, we have contacts of the people who were affected at the facility in BC, Alberta, Saskatchewan, and Ontario. So a coordination meeting was held this morning, and we will continue to coordinate across the country in managing this small outbreak. There's no risk to others in BC and around Interior Health at this time. Health authorities also continue to issue community exposure alerts, as we know, for a number of locations, as well as for flights coming in and out of British Columbia where cases of COVID-19 have been identified. So please check with those health authority website and follow the guidance that is on those websites. And that will tell you whether you need to self-isolate and monitor, or whether monitoring for symptoms is all that's needed, depending on the level of risk with that exposure. So there's a couple of things I want to report on today. One, if we could get the map put up. So today we are providing some local health area information around COVID-19. From the very beginning, we have been committed to providing as much information as we're able to around where people with COVID-19 have been here in British Columbia. Early on, as you know, we report it by health authority only because of the risk of identification of an individual with small numbers. As we had more cases here in BC, we were able to provide data to communities and to the public by what we call health service delivery areas, so a smaller geographic area. We are now at the point where we have sufficient data over time that we can even go more granular than that. And this is what we call the local health area map of COVID-19 cases. So this map will be updated on a periodic basis depending on new cases, so that we are able to maintain people's confidentiality. So as you can see from this, the map tells us things that we know, that virtually every part of our province has been touched by COVID-19. Communities large and small and geographically dispersed. But despite this spread, we must continue to find our balance and understand how we can continue to live with COVID-19 over the coming months. What it also reflects is the diagnosed cases. So these are the cases who were tested or were epidemiologically linked to COVID-19. And we know that there are additional people who were infected with COVID-19, particularly in the period of March and April, when we had limited testing and we knew that there were people coming from other places, for example, where they may have been exposed. So this reflects that as well. It doesn't reflect what we know now, that the contacts of people who have COVID-19. And right now we're monitoring over close to 3,000 people. And so this is a reflection of only the cases. So this means that restarting our activities once again, and at the same time protecting our most vulnerable and doing our best to keep ourselves and those around us safe, is something we must all continue to do. The other information I want to pass on today is that we will be reporting for the first time a number of suspect cases of what we've called Misk. And so that is the multisystem inflammatory syndrome in children and adolescents. And this is something that has arisen as being associated in some parts of the world with COVID-19. We've talked about this in the past. And we made this a reportable condition so that we could monitor it here in British Columbia. And now we are reporting our first cases of suspect Misk because the case definitions have changed across Canada. Previously, what we're reporting is only confirmed cases, and confirmed cases means you have a laboratory test or you've been a contact of somebody with COVID-19. In our case here in British Columbia, all 8 cases are suspect because they did not test positive for COVID-19 virus. They didn't have antibodies either, and they had no known exposures to COVID-19 cases. So we have no confirmed cases here in BC, but we are now, with the change in case definitions, we'll be reporting 8 suspect cases in British Columbia. As we know, Misk is very similar to a rare childhood condition that's known as Kawasaki disease, and we have seen children with that condition here in British Columbia every year. And fortunately, most patients with either condition recover completely, and that is the case with the 8 people here in British Columbia. They have all been reported by BC Children's Hospital. 5 are male, 3 are female. The median age was 4 years of age. And all were hospitalized. 2 children were admitted to intensive care, but all have fully recovered. These are serious illnesses, as we know, but this is a reflection of the fact that our system works. We have been monitoring this across BC, and we will continue to monitor it, particularly as we move into the coming months with things like school opening. So this is important information for us to continue to follow, and we will be doing that in the coming months. As we have learned, and as we continue to learn, COVID-19 requires new ways of doing things, new ways of living our lives, new ways of precautions, taking precautions, new routines for ourselves and our families, whether at home, at work, at school, or spending time with our friends and family. But what remains the same across BC is our commitment to continuing to learn and to adapt our approach. This is in addition to doing all we can to protect our communities, particularly our seniors and our elders, and those we care for most. So let's keep doing that. Let's keep doing our best, using the information that we collect every day as we're moving through this crisis together. And let's continue to be kind, to be calm, and to be safe. Thank you.